diet is one of the important things that is the cause for all the problems. Like excess salt will give hypertension, excess consumption of fats will lead to obesity, and excess consumption of carbohydrates and sugars is one of the risk factors for development of diabetes. And these are the things for obesity, etc. So most of the things arise from diet, and dietary discretion is one of the very, very important things, in my opinion, to have a sound mind and sound body.
Okay, I would say that law of inheritance works in heart diseases also. I tell this to my patients: when you inherit property and fortune from your parents, you're also going to inherit diseases. So knowing your cardiovascular risk factors is very, very important. If these diseases run in the family, so if your family or your elders have got diabetes, hypertension, or heart disease, you're going to get it. So please know your cardiovascular risk factors. As Dr. Pramod was mentioning, avoid smoking, eat healthy, exercise regularly, and sleep well. Keep your risk factors under control. And I would go all out to emphasize on this. Please know your risk profile and act accordingly.
So first thing is diet and exercise to keep your weight in check. So if your weight is exceeding, that means you're overeating. That means your caloric intake is high. So keep your body mass index. Keep checking your weight. Be obsessed with your weight number. Many of us are not. So be obsessed with that number. And if that number is going up, you're eating more. Reduce your caloric intake. Have a balanced diet. It is very, very important. And finally, avoid alcohol and smoking. Alcohol may not be zero, but smoking has to be zero. If one has to live longer, you can't smoke.
The first only thing I will like to tell my patient is have faith in your doctor and go with the advice of the doctor to have the best possible effect of treatment in your life.
Well, instead of categorizing 1 to 3, but whatever is important, I will say that most of the time we get the patient out of a distress and out of a serious condition. And we tell them that, look, though I've done an angioplasty on you, do not think that this is the end of the treatment. And once either a bypass or an angioplasty, lifetime I'm not going to suffer anything. That false confidence should not be there. You have to undergo regular checkup, periodic checkup. That is very important. Most important is to tell them that treatment is lifetime. And if you give them time to understand this, that this is a chronic, non-communicable disease and the treatment is often lifetime, we may have to adjust by increasing the doses, may have to do certain investigations, sometimes redo procedures. And optimal control of all risk factors of lipids to the levels which now in India, we follow the Lipid Association of India and we have started getting amazing results. We have started bringing down the death rate, which was not coming down because we were following the American and European guidelines, which are specific for them. We as the ancestry are different. That is very important. Total cessation of all products like tobacco, and even I've seen youngsters now getting onto vaping. You see, there may be tobacco in any form, not only just chewing. Even be very strict against this. What is not even taught in the books and told by doctors is a very good insurance. So you have to tell them to spend on insurance because these treatments are costly. And initially people take it very casually, mujhe kya ho sakta hai? And once it occurs, then they don't have that finance. So they may not take optimal treatment, not take it in time. So this is again a very important message and which should be inculcated. You have to take care of yourself. I would say these are the few important things.
Yeah, in my patients, I advise them to be careful so as to avoid second heart attack. And I always advise them to go for a regular walking at least 30 minutes daily and eat healthy food and stay away from bad habits like smoking and alcohol.
Yeah, so if we come to a crisp message for all youngsters, I would say there are 3 factors which are very bad for somebody's health or heart health, which are hurry, flurry, and worry. So hurry is if you are trying to do a lot of things very hurriedly and trying to attain the achievements or targets in a shorter span of time. So be patient. This is number 1. Don't try to have the shortcuts. I mean, go with your conviction, keep trying, keep following your dreams and try to achieve that, but have patience. So next is curry. Curry is all diet, bad diet which the youngsters are taking rampantly these days. So you have to avoid it. These cannot go together. The good health and a bad diet cannot go together. So bad diet has to be restricted. All the fried items which are so rampantly available at a message from a mobile phone. In 10 minutes they provide everything. So I think that has also made our society really horrible. So that curry thing has to be avoided, and one has to stick to a good healthy diet. And next is hurry, curry, and worry. I mean, you have to manage your stress well. Stress is also leading to a lot of increased heart diseases. So managing your stress again comes with a lot of training. Yoga is one way of training yourself to manage your stress. Sports or exercise is also very good. So if you follow this regime, I think you will be absolutely heart healthy.
So I would say first thing is take care of your diet. Use a healthy, simple diet, one that your grandmother would recognize and eat. That would generally be healthy. Take some snack or some non-veg, whatever you want, once in a week or twice a week, but not more than that. So have a healthy diet. That's message number one. The second message is exercise regularly. Don't take your health for granted. Don't think that today you can run around, after 10 years also you will be able to do that. Please exercise regularly. You don't need fancy equipment. You don't need a gym. You can just walk or run, use your body weight, use kettlebells or dumbbells. With simple exercises, you can do a lot. And number 3 is some form of stress management, which includes excellent restful sleep for at least 7 to 8 hours per day. If you do that, you will find that not only do you look young, you continue to look younger and feel younger and younger as you age, and you will have good health and lack of requirement of heart specialists like us. So an apple a day, as they say, keeps the doctor away. So good diet, exercise and stress management will keep you away from a hospital.
So I feel that the much more important role in case of pregnancies is the role of females, slightly contradicting Dr. Kunal, but I feel that the mother-in-law is the most important person in a lady's pregnancy time, because either she makes it or she breaks it. If you have a good mother-in-law, you may go overboard. If you have a bad mother-in-law, you may absolutely ruin the pregnancy and future life. A good ideal mother-in-law is, I think, the pillar of a good pregnancy outcome, and a good outcome for the baby, the neonate also. The mother-in-law will take over, taking care of the baby, and the mother has enough time to get back to her shape and, pre-pregnancy body weight and levels. But a bad mother-in-law or a neutral mother-in-law, so I feel that is the most important pillar. Of course, the second pillar is the husband. He has to many times intervene in between these two and sometimes act in concert with the 3 parties, that is the lady, the mother-in-law and himself. That's my 2 cents.
My key 3 takeaways would be, as for any disease, prevention is better than cure. So for heart disease as well, women should understand the risk factors, get themselves checked frequently, and whenever they have a risk factor coming in, intervene so that they can prevent the development of heart disease. The second important aspect is understand the signs and symptoms of the disease. So as soon as you have a symptom which may be related to cardiac disease, time is muscle as far as heart disease is concerned. So get yourself consulted earlier and ensure that you're getting a timely treatment if you are developing a heart disease. The third important thing is about secondary prevention. Once if you're unfortunate enough to develop a heart disease, you have to ensure that you are compliant with your treatment as well as lifestyle modifications to prevent further events, because this is, once it happens, it tends to recur. So you need to be periodic in your checkups as well as be compliant with your drugs, and thereby secondarily prevent further events.
Takeaways would be like, no symptoms or signs of any heart disease in a woman should be taken lightly. She should be appropriately taken care of. And as a women should focus more on a healthier diet, regular exercises, and they should take care of their health first, because if they are healthy, they probably will be in a better position to take care of their family. And as a healthcare provider, the main message is we should all try to avoid gender biases in diagnosis and treatment of heart disease in women, which are actually very rampant, and that is our all main goal, that we should try to minimize them.